It is estimated that roughly 45% of the U.S. population in the U.S. snores. And notice I say adults there, not just men, because whether us women like to admit it or not, we too struggle with it. And there's a whole list of negative impacts to your health. So thankfully, there's a solution. We have Dr. Ping Sauer of River Park Dental here to explain, along with her patient, Tracy Cruz. So ladies, thank you so much for being here.
Thank you.
All right, Dr. Sauer, I want you to talk about snoring as a national disease, which is what you call it. What makes it such a threat to our health?
So snoring is usually associated with obstructive sleep apnea. So what that means is when you're going to sleep, your soft tissue, which includes your uvula, your soft palate, your tongue, relaxes. But sometimes in severe cases that actually will close your airway. So then you aren't getting any oxygen in. And you might not know that you're doing this, but your body will automatically wake you up to bring in that air. But that forced air will vibrate your soft palate, which would cause that snoring sound. But the more severe cases, you stop breathing altogether, and then that then causes you to have not bring in enough oxygen, which then causes serious health consequences such as cardiovascular disease, depression, weight gain, all those things.
Yeah, even, I know you say waking up with headaches a lot of time. The likelihood is increased that you get in a car accident. We talk about that when you're exhausted, even during the time change and things like that. That can be such a detrimental impact on your day, your life.
Yes, exactly.
Okay, so it is not just the person who snores we often talk about as well. It is the people that love them, right?
Yes.
The people next to them are feeling the pain.
Yep. So, when I've experienced this obviously, but when I have interrupted sleep, I just wake up and I just feel restless. I feel tired, I'm groggy. So it's, it will benefit your bed partner too.
Your bed partner too. Okay, so Nightlase, that's what this is called. Tell us about this and how it works.
So it's a laser procedure, but when I say laser, everyone thinks I'm cutting or doing anything like that. But it's a gentle procedure. You don't need anesthesia. And what I'm essentially doing is I'm heating up that soft tissue, your soft palate. And what that does is it tightens it up and then opens your airway.
Okay, so let's get into Tracy's story. Tell me, first of all, Tracy, what led you to Dr. Sauer? What was your issue you were concerned about?
Well, I had been diagnosed with sleep apnea 6 years prior, and I had been using my CPAP very religiously, and I liked it, and I had gotten good results. But recently I'd been having trouble, especially with walking upstairs or exercising, getting enough air in. I was having problems with eating and being able to swallow properly. It just felt like there wasn't any room back there. And even laying down with my CPAP on, I felt like everything was closing up. And so I talked to Dr. Sauer, and she said that there had been some studies that found with long-term CPAP use or other sleep appliances that you start to lose the tone because the air is doing the work for you. The muscles in the back of your throat aren't necessarily working as well as they used to. So I let her know that I was interested, and we went through with it. So
that's so interesting, that the fact that you were using your CPAP as intended, trying to get those results, which a lot of people admit that they fall short of that, right? And that's usually what we see. So the fact that you were finding results and then all of a sudden it stopped working for you. So it's great to know there's another option. And then so you went through this process. What was it like? Dr. Sauer can tell us, but you experienced it.
It was painless. It's about a 30-minute procedure. And all I really felt was warmth the whole time. You just are comfortable, and you can just feel a little bit of heat around underneath the tongue, on the tongue, and in the back of your throat.
Results then? How quickly was it when you noticed a difference?
Oh, it's immediate. When she's doing the procedure, you can actually feel everything open up, and it's like you can start breathing again. And it was amazing.
And this obviously, the goal is to lead to a good night's sleep. When you first went home, right, and then you got this and you laid down for the night, were you thinking is this going to be it? Am I going to get a full 8 hours and not wake up in the middle of the night?
Yes, and it was. I mean, I went home and I laid down, and it was like everything was still open again, like it used to be, and it was so heavenly.
I was going to say, what just a relief, I feel like, of a feeling that would be. So, Dr. Sauer, let's talk about how somebody goes about kind of learning about this, and if they're interested, do they just come in and have a consult with you?
Yeah, so they can go on our website and get schedule online for a consultation, and then we just go through the process and the procedure, and then they just have to come back and do the treatments. It's usually about 5 treatments that work. Sometimes it's more, sometimes it's less.
Okay.
But 5 is the sweet spot. for most patients.
For getting the results. So it is so great to know that is there. The website up on screen, again, riverparkdental.com. You can head there. So thank you so much for being here.
Thank
Thank
you.
you.